Did you know that breastfeeding can lower the risk of breast cancer, ovarian cancer, and also can help the mother lose 600 calories when she breastfeeds? Assalamu alaikum. My name is Dr. Neelam. I'm a family physician and a breastfeeding specialist. Today we will talk about breastfeeding, the importance of it, and we'll also talk about some common myths that are encountered in our practice. Breast milk is the first and only nutrition that a baby needs from the time they're born all the way to the time they're 6 months old. It has all the essential nutrients they need. It has all the proteins, the vitamins, the fluids. It has all the antimicrobials. It's also known as the golden liquid because of all the amazing properties that it has. So the milk starts to be produced from the time the mom is pregnant, and by the time the baby is born, the milk is ready for the baby. Initially, the milk is called colostrum, and it is a yellow liquid. It could be very, very little, just a few drops, but it is enough for your baby because your baby only needs a few drops since their tummy is so tiny. That initial milk is very important for the baby because it has all the antimicrobials that the baby needs. When the baby is in the tummy, it is a very sterile environment, no bacteria, no germs. But as soon as the baby is born, there's so many bacteria and germs. So that milk is essential for the baby. You might feel that you're not getting any milk, but as long as you're putting the baby on the breast, the baby is able to get those few essential drops. This process is controlled by hormones. And that is why we need moms to be very relaxed during the delivery process and even after delivery. Do not stress the moms out. Once the milk starts coming in from day 2 or day 3 or day 4, that is when it switches from hormonal to more like a supply and demand thing. Now that here is a magic formula, supply and demand. The more the baby feeds, the more the milk that's extracted, the more the body will make the milk. And that is why it is very important not to introduce formula or water in the first few days, because then the body will feel that the baby does not need as much milk. And that is why supply and demand, magic formula. We could now talk about the importance of breast milk for both the child and the mother. Now, for a baby, it is very important. Breast milk is very important because it has all the nutrients that the child needs. It can help build up the immune system of the child and also prevent the child from getting infectious diseases. So a child who's breastfed will have less chances of having diarrhea, getting pneumonia, ear infections. It'll also help with prevent of asthma, eczema, childhood obesity, diabetes later on in life. Breast milk is also very, very easily digestible by the baby, and that's why it is one of the best things to give your child. It has the right amount of fats, sugar, water, carbohydrates needed for your baby, and it changes according to the needs of the baby. So you might notice when your child is sick, the milk consistency will be different. It might be a bit thicker because it has more of the good antimicrobials in there. And maybe it's a very hot day, so you'll notice the milk is more watery because it's there for the baby. It changes day to day depending on the baby's needs. It's also involved in the brain development of a child and also produces the gut microbiome for the baby. Now, moving on to the mother. Why is breastfeeding so important? One, it helps with reducing the calories and it makes the moms go back to the pre-baby weight, which we all want. Another thing is that it helps reduce the risk of heart diseases, breast cancer, ovarian cancer, and also reduces the chances of diabetes type 2. It also produces very happy hormones, which helps prevent postpartum depression in these moms as well. And after delivery, the uterus is big. So while breastfeeding, our body produces oxytocin that can help reduce and shrink the size of uterus to go back to the way it was pre-pregnancy. It really helps with the emotional and physical bond between the mother and child, which is very, very important. And best of all, it's free, it's always available, and does not need any preparation. There are 5 common myths that we encounter in our practice, and one of the most common myth is that breastfeeding is easy. It really, really is not. So when a baby is born, they have the reflexes to know where the breast is, and so they can start feeding. However, the positioning, the latching, it's a hard thing for the baby to adapt to, as well as the mom. The mom doesn't know. The diet needs a lot of practice and support from healthcare professionals. Another myth: it is usual for breastfeeding to hurt. It really is not. So initially, yes, the first few days breastfeeding might be a little uncomfortable because your body is still adjusting. However, if it hurts more than a couple of days, that is not very normal, and maybe there's a problem in positioning, maybe there's a problem in latching, maybe there's a problem with the baby's anatomy, the oral anatomy, and this needs to be looked at with a professional. Another myth: many mothers can't produce enough milk, or my baby is not getting enough milk. Well, that is false, because most mothers can make the right amount of milk the baby needs. Now, every day you will see the milk volume will change depending on how much milk is, how often the baby feeds, how much milk is extracted if you're pumping, and how well the baby is latching on. So the weight gain and dirty diapers is what determines if the baby is getting enough milk or not the amount of how many times you're feeding your baby. Just something to note, that babies cry. Crying is their way to communicate. So every time your baby is crying doesn't mean they're hungry. It could be the baby's feeling cold, or the baby has a mosquito next to them, or has a dirty diaper, or it just wants a mom to hug the baby. So it doesn't really always mean that the baby is hungry. Another myth is that babies don't need breast milk after starting to eat food. That's not true. So it is recommended to feed your baby for the first 6 months exclusively, and then continue for 2 more years before you stop. Now, after 6 months, when you're introducing food, milk will still primarily be the most important food for the baby. And slowly the baby will start reducing the amount of milk taken, but still it is very important because of all those good things that the milk has, like protecting them from getting infections. And the last myth is breastfeeding will prevent you from getting pregnant. That is unfortunately not true. And although while breastfeeding, many moms do not get their menstruation, they still need to be seen by their healthcare professional to talk about other contraceptives uses. And I would like to end by sending a message to all my mothers who have been breastfeeding that you guys are superheroes, because you are awake when you're feeding your child in the middle of the night at 3 a.m. when everyone else is sleeping. So big up to you guys. Thank you very much.